Hi, I'm Annette Giangiacomo. I'm an ophthalmologist at Tower Clock Eye Center. I specialize in glaucoma, and I thought I'd like to talk to you today about what you might expect for your initial evaluation if you come to the clinic for glaucoma. So first of all, we're going to get a thorough history for you. There's several risk factors for glaucoma that may be historical. So history of prior eye surgery, history of injections in the eye, history of trauma, things like that. In addition, we will also want to know about your medications. So certain medications put you at risk for developing glaucoma, including use of steroids. Then we'll check your vision as we normally would, as well as check the pressure of your eye. Elevated pressure is a risk factor for developing glaucoma, and so not everybody that has glaucoma has elevated pressure, but we like to know the pressure because if it's elevated, it is a risk. The next thing we'll check is the thickness of the very front surface of your eye. The cornea is the clear surface on the very front of your eye, and if that is measuring thin, that is a risk factor for developing glaucoma. Next, we will check the angle of your eye. There's a few different types of glaucoma, and the appearance of the angle helps us determine what type of glaucoma you might have. After we evaluate the angle, we will dilate your eyes, and this will make your eyes blurry, so you'll need a driver when you go home that day. But when we look in the back of the eye, one of the main things we look for is the nerve. The eye is supplied by many different nerves, but there's one main nerve that connects the eye to the brain that helps us see. And this nerve is the optic nerve, and it can degenerate over time if glaucoma is setting in. So we evaluate that with an exam, as well as with a test called an OCT. After you have your dilated exam, we'll often obtain the OCT to measure a particular layer of the eye that can be affected by glaucoma that we can't see, but the OCT can evaluate. And finally, we look at the visual field. The visual field test maps out the peripheral vision. So classically, what glaucoma does is affect the peripheral vision, and we measure that with the visual field test. All these tests in total take a couple of hours, so for your first visit to see us at Tower Clock, I recommend that you do give us a couple hours to get everything taken care of.